anything, any issues related with fertility, sexual disorders, and as well as mental disorders in those conditions where the cognitive functions. Then comes the palya action, that is wherever there is a what do you call the tissue loss, or wherever there is weakness or any muscle building or body mass criteria are there. So such type of conditions. Then comes vata rogas, wherever there is a huge set of vatanadi diseases. So in those conditions, ashwagandha plays a very vital role, and it is one of the versatile drug of Ayurveda, extensively researched drug, as well as it has been since the ages. It is in the usage, and of course, it's given in multiple conditions. Most of the Ayurvedic drugs, as well as even ashwagandha, is one of the multifaceted drug of Ayurveda. It is extensively used in various conditions. It is even given externally, as well as it is even used in internally also. So versatile drug, and extensively it is researched, and it can be used in multiple conditions, including arthritis and even all those conditions particularly. But general practice and most of the occasions, the people we use it in vatanadi or vataja disorders, what you call as neurological neuropathy conditions and such type of things. And then sexual disorders are where infertility and reproductive issues are there. So this is the very vital area where ashwagandha is in extensive usage.
Can you please tell us about main Ayurvedic medicines containing ashwagandha that you have found tremendous benefits with?
One is ashwagandha rasayana, a versatile combination. It is in the form of a jam, or what you call it, just like Chyawanprash or leha format, and it is extensively used. I use it in cases of male infertility, particularly oligospermia, azoospermia, and such type of conditions, where and even the male erectile dysfunction. So such type of conditions, extensively this is used, and as well as where there is a wasting, like post tuberculosis or any other infectious diseases, or long-standing illness or chronic illness where patient has lost tissues. So in those conditions, I use a very recommend ashwagandha as well as ashwagandha rasayana. And the second thing what ashwagandha I use it is usually in the form of a powder. Ashwagandha powder boiled in the milk, and it is given to drink. And this is also a very good one for the particularly where there is weakness, tissue loss, and such type of things.
Ashwagandha Kshirapaka, I think in Vaishnaja Ratnavali especially, they have told it that, to improve the muscle strength of the children and general immunity also, it is told. The Ashwagandha, the Rasayana that you told, sir, I think there is this Ashwagandha Rasayana and there is Aja Ashwagandha the Rasayana. So which one you use?
I use totally a pure vegetarian one, without amisha, without any combinations of mamsa in that. Aja, mamsa, mixed varieties also are there in the market, but I don't use it. I use it pure herbal, totally herbal oriented one, and without any mamsa in that. Ashwagandha the rasayana. Even in the there are many companies, they are producing ashwagandha rasayana in very versatile combinations. Ashwagandha the rasayana, like there are ashwagandha leham. All these terminologies are there. So there, from company to company or pharmacy to pharmacy, there is a change in their configurations as well as in the ingredients and even the quantum.
Yeah, I think this Dabur and Kandiga Organics are the two companies that I remember which manufacture with the vegetarian version. Interesting that you mentioned about the Azoospermia. Have you seen tremendous results in case of Azoospermia also, or can you share a case with that which you can?
Yes, recently I had one case with Azoospermia, a very documented case of Azoospermia, wherein the exact reason for that azoospermia could not be made out, but only semen analysis was the thing was carried out. Later, the patient was given the regular protocol of ashwagandha rasayana, and I got one phala Gritha in the form of capsules that I use it, and pushpadhanva rasa, and these type of combinations I have used in, and within a span of 6 months, that result has come, and even the female partner become pregnant, and the thing is settled down. And that one of the of course I wanted to just after the treatment protocol I wanted to take out the semi-analysis for the comparative study, but before I could do that the result was there, so I could not do that.
In case of infertility, though husband or wife, they may come with their own problems, but it's so very important to examine both and treat both kind of simultaneously, because we do not, sometimes we miss the other person having problems.
No, in my practice, usually I call both of them because they both need to come over there. And but many times in Indian setup, we have seen that male partner has a lot of male egoistic notions, and he won't come to doctor, and always sends the female partners go for changing the doctor and take medicine, and always abusing her that she is not getting pregnant and all those things. It's a very common practice in India, we have seen. But in my practice I convince my patients that you should both should come, and usually they'll come, and very specifically we evaluate both of them for both the female and the male. Then whoever may be having the problem, accordingly the treatment will be made.
So usually in a classical disease, like classical health problem like infertility, on an average, how much months of treatment is required?
Usually, I make it as a practice maximum 6 months. Anything which should be result oriented, it should take place within 6 months. Usually, whatever the combinations I make initially in any patient, I'll give it for a course of 1 month first. Then I'll ask them to repeatedly come for things, and I'll ask for any changes or whatever they felt. Then afterwards, at the end of the 3 months, if there is no pregnancy, then I'll go for once again a semen analysis and such type of things, and I'll try to compare with the previous records. And once that is done, any course correction is to be done in the protocol of a treatment, then I'll go for that at the end of the 3 months, and once again I'll complete it for another 3 months. But within that 6 months, I should get the result. If it is not there, then there is a clear-cut problem, and that cannot be handled through medical management. So it requires some other thing, or it may be beyond the reach of the medicine.
So do you always prefer Panchakarma ahead of oral medicines, or sometimes you just go with oral medicines?
No, it is usually recommended, but most of the time the patients will not be ready for that. They want something, a shoot shot or a pill type of thing they should consume, and they should get the things done. So most of the time it is not possible. Only a few patients, those who have already gone to shopping to the many doctors and they are suffering from a long term, then they will go for the whatever the Panchakarma procedures we say that. Otherwise, most of the time it is straight away. When a patient comes, it's a shamana chikitsa only. It is not, it's not the Shodhana chikitsa.
Like this Ashwagandha Rasayana, can it be given in this post pulmonary tuberculosis patient, and also in what duration after is that they can be taken after 6 months of their regular allopathy medicine intake?
Let me tell you one thing. There is a study conducted in King George Medical College, Lucknow, wherein very clearly they have initiated the use of concurrent use of ashwagandha while giving the multi-drug therapy for the tuberculosis. So it has been even shown that once if you add ashwagandha to the multi-drug therapy combination, the result will be much faster and the recovery is much faster when compared to the groups wherein ashwagandha was not added. So there should not be any hesitation to adding ashwagandha to a patient of post-tubercular treatment or at the time of even multi-drug therapy of modern medicine which is going on. So you can directly use ashwagandha and it will benefit the patient in a very big way. Now the reason is very clear. Reason is very clear. If they are all staying in one house, then they have communicated to, the inspection has transmitted from one to one. So that's the reason. So everybody is having. So everybody should go for first. Once again, it's if there is a pulmonary tuberculosis, then isolation is a must for the patient. When we don't do isolation and simply in a community we live together, definitely there is a possibility of transmitting the infection, and that's what happened taken place. And no, nothing to worry, but it is a curable condition. We can go for a multi-drug therapy. Along with that, many of the Ayurvedic medications are there, wherein you can even ashwagandha, the rasayana, and if a patient is able to consume the non-veg, no issue with the non-veg, then you can go for the chagalya, the rasayana is also there. It's very good. Ajamamsa rasayana is also there. That is also very good for these conditions. You can use them.
Okay, sir. Thank you. Thank you for your suggestion.
Thank you, Dr. Vivachana, for the question. And another point that I observed in her narration was that she wanted to wait till 6 months. I don't think there is real need for waiting till 6 months of starting of tubercular treatment. I think that both Ayurveda and the modern tubercular treatment can go hand in hand, sir.
Yes, concurrently it can be used, and I have used also in many conditions such type of things. So concurrently you can use it, which gives you wonderful results. I had a chance of treating one tuberculosis patient, and it is typically a non-pulmonary tuberculosis. A patient was from nearby to my place. They have already gone to many places for that. Diagnosis was not made properly. Then I suspected it is a case of tuberculosis of other than the pulmonary origin. Then I went for the all the blood checkup and even this one. Then it came out to be tuberculosis of the omentum. And in that condition, patient was having a lot of abdominal pain and diarrhea and vomiting, and she has lost a lot of body weight and tissue. Then we went for the regular anti-tubercular treatment along with that ashwagandha, the rasayana, and these type of things were started. And within 3 to 4 months, she has put on a lot of weight and she has increased her condition and improved in a very big way. And she was so happy.
From your lectures from Dravagana time of my BMS, you were telling that even Kushmanda Rasayana is also very good.
Yes, definitely. Kushmanda Rasayana is also one of the very good combination yoga for the post respiratory infections or post COVID type of thing, or even the tuberculosis, or even the Urakshata type of conditions. In those conditions, Sarpiguda, Kushmanda Rasayana, Ashwagandha Rasayana, Chagalyadi Rasayana, these are very wonderful combinations and yogas described in Ayurveda.
This is like post respiratory tract infection that you were explaining. But when there is cough with sputum or the kaphaja, shwasa and kasa, when they are there during the disease, this Sarpiguda or Kushmanda Rasayana is not that effective. We may have to go with, say,
if it is, there is a cough and there is a blood in the sputum, then a preferable choice will be Vasavaleha. Vasa containing drug, because its Vasa is one of the important Kasa Shwasa Raktapitta Haranam. So that drug should be used there in that condition.
Coming to the main question that immunity and its relationship with ashwagandha, or the ashwagandha and its relationship with immunity. There are some papers which say it as immunity boosters, and some are telling it as a immunomodulator. In fact, this Serum Institute of Ayurveda of Pune, and in 2009-10, they had applied for Withanolites A and B for their extracts of ashwagandha to be used in conjunction with vaccines to kind of act as an immunomodulator to boost the efficacy of vaccines that they were producing. So my question to Dr. Gururaja sir is whether it is immuno-booster or immunomodulator. If it is immuno-boosting, so I assume, there was a question in the last class also before you joined that should it not be used in case of organ transplant where immunosuppression is required? Can you please throw light on that, please?
See, we need to understand the activity of ashwagandha in a very important way. Not only in ashwagandha, for any drug of explained in Ayurveda. Each and every drug explained in Ayurveda has its potential. That is called drug potential. A drug has rasa, guna, virya, vipaka, and all these are capable of producing it. We know that certain action of a drug is due to rasa, certain action of the drug is due to virya, certain action of the drug is due to vipaka, certain action of the drug is due to its gunas. So not all the actions of the drug is only due to a particular things. It may be a multifaceted one, and the multiple things present in a dravya can able to produce the particular type of actions, the karmas or prabhavas. So in that scenario, just first of all, we need to understand that what the drug capability or the drug potential. Each and every drug has its own rasaguna, virya, vipaka, and that is the potential of the drug. Second thing is where we are using those drug indications. So in which condition, whether we are using in a particular pathology or etiopathogenesis, and intention was to break that samprapti. So when such intention, with that we are applying this drug, then our concentration will be on that, and even drug also does the same thing. Just to observe that Ashwagandha is said to be as an aphrodisiac, vrishya in Ayurveda, and it has been even researched by the Western and it is as claimed and it is confirmed that of course it is an aphrodisiac. My question is whether if I give ashwagandha to a child of 10 years, is it produces as an aphrodisiac effect? No. So it means a drug to act on the body, it requires a prerequisite condition over there. If the body has that prerequisite condition in the form of a doshic imbalance or the dhatu damage or something like that, Ashroto Kavaigunya, then accordingly some disease manifestation has taken place. There is an etiopathogenesis, and to overcome that or break that etiopathogenesis, then we'll have a particular drug is used. So in that sense, when we are using a drug, we should understand that for what purpose we are using it. And if you observe all these studies, whatever done, either single blind study or double blind study, placebo control study or open trial, whatever it is, everywhere there is an intention of the study. Looking at that intention, they are only just checking up that whether the drug does the thing or not. Then ultimately at the end of the study, they say, yes, drug does this. When a drug of this nature of ashwagandha, having a multi-faceted actions or versatile actions, its actions are seen all other systems in the body, then if ashwagandha is given to a patient, we don't see all the actions over there. This drug action is possible only where there is a prerequisite condition of that particular pathology. For example, if you are using ashwagandha with an intention that there is an arthritis, so whether it is going to act as an anti-inflammatory or not, then there will be anti-arthritic effect you could see. If you are putting ashwagandha to a patient where there is an vrishya requirement is there or aphrodisiac requirement is there, then that action is seen. But we don't find same action in a child because there is no that prerequisite Agni is not there. Shukradhatu Agni is not there, a particular type of Agni is not there, which can be converted to the drug requirement and take it to the place where it is required. So we need to understand these concepts fast. Simply that the drug capability cannot be acclaimed and taken into everywhere. Then comes this particular question of organ transplant, whether ashwagandha type of things should be used or should not be used. It is right. In an organ transplant patient, you observe that why that rejection takes place. That allograft, whatever it is there may be even after, whenever they'll go for the transplantation, they'll check blood matching and organ matching, everything they'll do. After all those things that surgery is done, even in that with all suppression things, they use it, immunosuppressants, in order to avoid any rejection. But still there is a rejection. And that rejection may be classified as acute rejection or it may be chronic rejection. We have seen the rejection of allograft even after 2 years, 5 years, maybe due to there is a blockage in the supply or vasoconstrictions takes place or many other issues are there which are unknown. Why the body is behaving like that? Or maybe for what condition, what is the disease which is responsible for the damage of the earlier organ, the original organ. That's why you are going for a replacement. The same disease may be continuing with even the new organ. So without keeping all these things, simply blaming the thing is not right. Second point, when an organ transplant is done, definitely in order to suppress the immunity, to avoid any triggering of the immune responses, immune suppressive drugs are given of modern. So in that condition or in that patient, after a certain time, when it still is under immunosuppression drugs, if I give ashwagandha type of drug, which is a immunostimulant or immunomodulator, which enhances the immunity, definitely there will be reaction. There is a possibility that may trigger reaction. So it is not an intended area where ashwagandha can be used. We should be very restricted and constrain ourselves what to or where to use it what. So, and because already in those patients, I already described, it requires a prerequisite condition, then in that prerequisite condition only a drug can work. So here you observe, ashwagandha has all the prerequisite condition here because patient has been given lot of immunosuppressants, immunity has been suppressed, so immunity is deprived there. So if you give ashwagandha with the context to that, definitely its a scope is there for it to improve the immunity. So it will improve the immunity. So it will boost the immunity. And ashwagandha is a non-specific immunity booster or a modulator, so it will definitely enhance. So in a patients of these type of nature, or what you call transplanted things are there, better take care or avoid as far as possible unnecessarily. Don't confuse and don't you drag yourself into controversies. Avoid those things, because there is a potential in the drug and the scope is also there at the condition, because of the using of a lot of immunosuppressive drugs in the modern for those patients. So it is better to avoid those things.
Thank you, sir. Pradeepa ISMG has raised her hand. Please go ahead with your question.
Namaste, Dr. Gururaja and Dr. Janathan. So it's interesting to see how ashwagandha can be a nervine tonic, like a nervine nerve relaxer. At the same time, it's also like a balya to enhance energy. And when I've prescribed this to some of my clients, I've seen some of them coming and telling me that right after ashwagandha, they feel like a boost of energy, and they have so much energy when they come to the decline in the afternoon. And some of them keep telling me that it's also working for them to put them to sleep. So what would be the best time to give them ashwagandha, or does it have to be given as in with an anupan to get the best results?
See, very important thing is what is the intention, or where you are intending to, or what the action you are expecting, in which type of patient you are using. So that is one important thing. While taking the history of the patient, you need to even collect the information regarding the work, nature of the work, what type of habits he had, and all those things. Then accordingly you can plan a total protocol. So while doing the total protocol, it is better to check all those things. If you have a patient is having to work for a longer hours, and if you give ashwagandha, then it may induce some sort of sleepiness. But it doesn't mean that in all the patients we get this. And if you observe that, is there's one of the wonderful drug with the nervine tonic and all type of conditions, vataja conditions, you can prescribe it in 2 times a day at least, in the morning and evening, with milk, boiled with the milk, and you can give it. So this is also one important thing. And there are many other certain factors like age of the patient, agni of the patient, and condition of the patient, which place they are staying. All these also come into play. Then accordingly you can decide what should be given, how it should be given. And not in everybody it will induce the sleep. And it is a Medhya Rasayana. One who is under severe stress maybe get relaxed and he may feel comfortable and he may get a sleep. But may not be other person who is not under stress. Maybe he wanted some pain was there, so he will feel reduction in the pain and he will feel comfortable with the day-to-day activity. So that's the reason you need to have on lot of other things like dosha, dushya, agni, srotas, and every concept to be taken to care. Then you can go for prescribing the things accordingly. And Anupana is always best with this is dugdha, because ashwagandha is having tiktarasa, Katuvipaka, a little bit ushna. In order to avoid those, there is a little bit chances of irritation sometimes, or even longer usage, it may have some sort of ushnata created in the body. In order to overcome that, if you add this one with dugdha, then our dugdha will take care of those ushna part of the ashwagandha and it will be nullified. So that's the better combination, what I feel.
Thank you so much.
Sir, I want to ask a typical US question. The patient is not willing to take milk because many people are vegan. So what could be the substitute?
What is the next option?
Yeah, every time I say milk, next question will be like that. So that just I transfer my headache to you. Medicines which act as Medhya or has which have some kind of effect on brain, and if there is a probability that they would increase sleep or they act as a mild manodoshahara effect is there. So we should be very careful prescribing these kind of herbs like sarpagandha or ashwagandha in people who work as like professional drivers or who work with heavy machine equipments, because it may induce kind of sleep and it may they may damage themselves. it may cause harm in themselves.
That's the reason what I said. We need to go for a collection of information while taking history from the patient. What sort of work they do it, and what is their nature of work in office, or whether they work with any moving tools or something like that, or a shop instruments, or any chemical area, or what sort of things they are using it, or their place of work is. So based on that, we need to go for it. And if it is the intention of using ashwagandha for the purpose of Medhya Rasayana or for stress reliever, it is better to give it in the night. And particularly sarpagandha type of drugs, which is used for the reducing the blood pressure and such type of things, accordingly, we need to give it in the afternoon and night. So this is the usual tendency.
Like you told, same Medhya herb which can increase sleep in those people in whom the sleep is required or who are sleep deprived, and it may act differently in different patients. So I even seen with the same with the case with Brahmi also. Some people with Brahmi they sleep, but some people they even if they take in the night they feel more alert and they might not sleep. It also depending on the patient's need and also type of patient.
It is once again it's a type of stress they are going through, and once again it is depend on the dosage of the drug and something. No, it is said that like alcohol in a very low dose acts as a stimulator, but continuously if it is taken in the high dose, then it becomes a depressor. So something like that. So here also, if a person is having a little bit of stress and it is easily the stress is relieved, then automatically with a simple dosage or a small dosage, you will feel Medhya in effects and even the sleepiness. But if a person is having too much of stress, even with the Jatamamsi 2 tablets, he may not get the sleep. So that is there. That depends on the type of stress they are going through.
And sticking with ashwagandha, the age-old classical question, not age-old, at least contemporary worldwide classical question: singular usage of ashwagandha or polyherbal usage of ashwagandha in different kinds of formulations and yoga. Which do you prefer? And in which the side effects or unwanted effects are very minimal.
I don't see by using ashwagandha any side effect could be seen. I have not observed anything like that till my practice of 21 years. I have not seen any such type of ashwagandha by using that. Only thing which can be used is by continuous usage of ashwagandha. Sometimes the person may feel some hotness. So to overcome that, dugdha is the one option which is best one, and we use it as a dugdha pana, and that will take care of the things.
Chemical extract of a particular herb versus the whole herb, or it's a common liquid extract such as aqueous extract, as in case of kashaya. So this is where the line can be drawn between the modern research and the traditional Ayurveda. So I just was going through the cranberry usage. Cranberry is very famous in US and Western countries. A cranberry as such is very good to treat or prevent liver disorders, and especially in liver cancer also cranberry is very useful, the fruit as a whole. But there is in wherever there is an efficacy of a single substance, they will and the researchers will go for its extract, so that the extract or the particular chemical can be taken out and that can be synthesized to make money out of it. So the researchers try to extract out the cranberry chemicals, and none of the chemicals that they extracted was not acting as effectively as the whole fruit of cranberry. So ultimately they gave up, and even the cranberry syrup or cranberry sauces, so they do not have that much effect. The whole of the cranberry fruit is having that particular liver cancer preventing and treatment effects. Probably if a company is just extracting a few chemical compounds of ashwagandha and using it and marketing it as a capsule, and if you use a capsule, that may not give the desired effect versus the whole herb in the form of kashaya or chuna or whatever.
That's the reason. That's what I said. Ayurveda, we use a drug as a whole. We don't go for the extraction. And extraction is not the whole drug. See, that's why Acharyas are very clever. If you observe that Panchavida Kashaya Kalpana, what explained in Ayurveda, one is directly crushing the drug and make it in the form of a swarasa, extracting and giving it. It is no solvent is added there. Then comes the churna form, dry powder, and it is given. Then comes water soluble extraction, kashayas, where all water soluble contents are taken care of and it is used. Then comes Thaila and Gritha, where lipid soluble extraction is done and it is given. Similarly, when Ayurveda speaks about the drug should be given as a whole, and already I explained that our drug works by virtue of its rasa, guna, virya, vipaka, and everything. We can't simply stick on to some molecule and say it is this one, because curcumin cannot be haridra. Haridra is something big. Curcumin is only one content from the haridra. Similarly, withanoloid is not ashwagandha. Ashwagandha is something big. So we cannot use as such a single molecules and extracted form as a drug and anticipate that it will have all the effects or functions of ashwagandha as a whole. No, it cannot be. We cannot have such effect. And even sometimes when we use such type of extracted and single molecule from any herb soils also, and if we are using it, sometimes we may get even side effects. Untowards adverse effect could be seen, as we have seen in Sarpagandha. Sarpagandha as a drug as a whole, if you given, nothing will happen. Results are seen as a very conducive one. But if from the Sarpagandha, if reserpine is extracted and used, then there is a good result of controlling the hypertension. But also patient will have a suicidal tendency will be developed. The such effects are seen when a molecule is extracted from even the herbal sources. So a molecule from the herbal source also, it is not the drug as a whole. Ayurveda always speaks about in favor of giving the drug as a whole.
Okay, so I have emptied the questions to Dr. Gururaja sir regarding ashwagandha. If any of the participants, if they have the questions, please raise your hand or unmute yourself. Yes, Pradipar Rasamji, please go ahead.
Thank you, Dr. Janardhan. One more question, Dr. Gururaja, is ashwagandha, or have you ever used ashwagandha in like post chemotherapy patients, or does it just increase more heat in them?
Definitely, post chemotherapy, ashwagandha is one of the important drug, and it can be given and it should be given, and it is a very good one, because post chemotherapy the immunity of a person is dropped down to a too much because of the chemotherapy drugs and the disease also. So in that condition, definitely ashwagandha has a very, very important role to play, and ashwagandha can be given in that form. Particularly if your patient is unable to take it because of some even associated along with the diabetes is also there and something like that, then we cannot go for the ashwagandha rasayana to be given. Then we can give it in the ashwagandha churna form, in the capsule form, or even ashwagandha ganavati. So all these things are there. If patient is not having any issues with the sugar or diabetic type of thing, then definitely we can go for ashwagandha rasayana.
Is this post the final chemotherapy, or can it be given in between 2-3 sittings of therapies?
No, even in the from the beginning also you can start. Even at the time of chemotherapy also it can be given, and it won't interact with that chemotherapy drugs as such. Only thing is that even it avoids the complications created by the chemotherapy usage, chemotherapy drugs. So nothing to worry. You can use it concurrently with the chemotherapy also. Only thing is that a drug of chemotherapy, if it is in the form of a pill or something like that, don't mix it with directly with ashwagandha churna and take it. Give at least a physical distancing of at least half an hour. Time bound management is to be done. Otherwise, nothing to worry with that.
A follow-up question, like is massage prohibited during these phases, like with bala ashwagandha taila or anything during chemo, or did you ever see patients getting abhyanga during the chemo phase as well?
No, that depends on what type of cancer they are going through. If it is patient requires abhyangam, in case of chemotherapy, because of chemotherapy, person has become weak, lean, and tissues are lost, and pain is there, then we can go for abhyangam. But once again, in that also, that depends on whether what sort of abhyanga is required, whether it is a mrudu snehana required or it is a very classical way of panchakarma is required. That depends on the patient to patient, because we need to customize everything in panchakarma. Every patient, it is not a just a tailor-made one shot go for everything. No, that is not like that.
Again, probably the question came because in ashwagandha is Ushna, and in chemotherapy also the body heat increases. Again, that's why Gururaja sir told particularly to use it along with milk. Dugdha will counter the any pitta aggravation effect, if at all, ashwagandha produces.
And even if it is required, ashwagandha can be given in the form of Gritha. Ashwagandha Gritha is there. A very classical preparation is there, wherein only ashwagandha, kshira, and Gritha is there in that. That is ashwagandha Gritha. That is also a very versatile combination, and a very wonderful results are there. Particularly even in the arthritic conditions where there is a tissue loss and any such type of things, and even in the post-COVID, many times we have used ashwagandha Gritha. That is also one of the important combination.
Yeah, coming to this ashwagandha usage in massage, Bala ashwagandha Taila is one of my favorite oils to, especially in children. Say after 3 to 4 months, in the infants, I usually it's one of the oils that I use to improve the muscle strength and to make the baby strong. So, do you use ashwagandha oil or Bala ashwagandha Tailam, or what is your experience with that?
Yes, I use a lot of Balashugandha Taila. Balashugandha Taila is there, and even the Kshira Bala Taila is there, and even I use Dhanvantram Taila is there. But Balashugandha Taila is one of the versatile drug, particularly where there is a neurological conditions, particularly neuropathy, as well as there is a wasting. So such type of Vataja conditions. Even I have used in recently one of the case of Guillain-Barré syndrome. She is recovered after the third or fourth sitting of Panchakama and regular internal usage of medicines. And it has been now she could able to walk up by herself. When she came over, she was on a trolley. Now she could able to walk by herself. There is a lot of improvement with that. So Balashwagandha Taila is one of the things which I use in many occasions. Firstly, in case, as you said, in case of children, for massage and bone strength increasing, muscle strength increasing, and all those conditions. Secondly, we use this Balashwagandha Taila in case of pregnant women in order to give strength to the waist, particularly for the waist, and even after the postpartum and even after the delivery. Particularly, we go for Abhyanga with this Balashwagandha Taila. Then, of course, in all the Vataja conditions and diseases, even the sciatica and all those conditions, of course, along with that, we add some little bit of Karpura Taila to give an effect of tingling sensation, and that will counter irritation and which brings the pain thing into it. So it's one of the important combination, Balashwagandha Taila.
Do you use it for basti or only for external application?
No, I use it in a lot of external application. For basti, usually I go for with Kshira Bala Taila.
So we'll wrap up for ashwagandha and we'll move to the next herb. I remember that in Dravina classes also we were taking 2 herbs in one class. I went with Shilajit. So this Ashwashila, I think this Patanjali makes this, Divya Pharmacy makes this Ashwashila with ashwagandha and Shilajit. This Decrim Plus for one lady patient who was having like obesity issue, and she came back saying that it contains Shilajit and it can increase testosterone. Why have you given? So patients, they do their own research, and now that internet is open to everyone, they will ask. So the question is, before coming to that, what are the qualities of Shilajit that you appreciate, where you use? Please start with the introduction and your clinical experience, please.
See, Acharya Charaka has very clearly said in Rasayana Adhikara, Shilajatu is one of the important Rasayana Dravya. And Shilajatu is Anamla, a little bit of Amla, Nati Ushna, and Tikta Kashaya in nature, and Katu Vipaka. But it is such a versatile drug, and it is said that by using Shilajatu, there is no disease which cannot be cured. Such a credit has been given to the drug. So once again, this drug is also a Vichitra Pratyarabdha, and it having a multiple role, and it is a multifaceted drug, and it is being used since the ages. And this Shilajatu, of course, there is a lot of controversy regarding its sourcing. Some say it is totally mineral, and some say it is a resin from a plant, and it is a combination of both. some say it is a fulvic acid, and some say it is even humus mixed and mineral pitch, bitumen, so many things are there with this. But what the presently market we get it is a combination of all these things, of course with the various concentration of fulvic acid in this. But the thing is, Shilajatu, once again, as I said in the case of ashwagandha, drug potential, the ability of the drug is at one set, and what actually drug is doing in the body, that is another thing, that is karma. A drug is capable of producing so many actions, but doesn't mean that all these actions are being going to happen or it takes place inside me if I take this drug. No, there should be some prerequisite condition. If there is a prerequisite condition, then if I take the drug, then there is the change. Then the question arises here whether Shilajatu has influence over testosterone, and if it is given to a female and if testosterone increases in the female, then what will happen? Yes, it's a big concern. But reason is, we don't find such action in women. The simple reason, the women or womanhood is supported by various hormones that we call as Agni, and they are interlinked to one another. Testosterone is present in both in male and female, but their concentration is much higher in case of a male and compared to female. In female, the activity or expression of testosterone is controlled by the expressions of the estrogen. There is a more estrogen, and that estrogen will going to suppress the activity of testosterone. So no question of the testosterone simply will spurge out. That will not take place in that manner. So whenever a patient who is already suffering from a condition like PCOD, or a patient suffering from some infertility issues and some problems associated with it, and already there is a surge of testosterone in her, so that is a careful area where we need to take care of. In those areas, we don't want to give any Shilajatu over there. Otherwise, Shilajatu as a drug, it also improves the female fertility. It is also improves the anemic factor in the female. It is one of the important Rasayana dravya. It is very good for urinary tract as well as reproductive tract. So it is having a lot of positive effect on the body. It doesn't only directly go and increase the testosterone. Testosterone is, what are the studies available saying that Shilajatu increases testosterone? You observe those studies. In there, those studies very clearly said it is based on some volunteers. So who are those volunteers? The volunteers are in between the age of 45 to 55 and all are male. They didn't study it on the female. So don't worry that if it is given to a female, it is going to harm. No, it's not going to harm. Only thing is that we should be very careful while using Shilajatu. If at all already the patient is having increased testosterone due to PCOD or something like that, or increased aldosterone in her. So in those patients, take care not to use those things. That's it.
Again, the same question. What are your favorite Shilajit medicines?
I usually use a simple Shilajatu one. Otherwise, I use it in Chandra Prabhavati, and another is Navaka Gulu. We have got another one, Shilajatu capsule, that I use it. As a Shilajatu as a Rasayana for the purpose of that, because of its controversy in getting the standard thing every time, I usually keep it as a second line. I don't use it as a frontline drug for that.
What are some of your recommended brands? Dr. Vaidya Pradeepaji asks.
The same word, the Chandra Prabhavati is one of the important one. Take it from a reputed company. That's the only one thing what I can suggest. Who is doing classically without any abrupt changes or modifications in the method of producing it. And even you can use it Shilajitvadi Vati, Shilajitvadi Yoga, that is also there. Then we have got Shilajit capsules, but preferably Chandra Prabhavati is the one of the versatile combination of containing Shilajatu, which I use it. In most of the conditions, I use it in combination with that, like Arogyavardhini Shilajatu, Ashwagandha and Shilajatu, like that, Bala and Shilajatu. So that's type of combination, the Draksha and Shilajatu. So type of things we use it. Only thing is, while using Shilajatu, take care not to use Guru, Ushna, Vidahi Dravyas, and as well as even Kulatha. That should not be used. Even I have seen in market one of the company because Shilajatu is very good drug for urinary tract infections and UTI and all those things. They wanted to make a combination, and they wanted such a made a combination that Pashana Beda is also there, Shilajatu is also there, and in that even Kulatha is also added. It's a quite contrasting. It is there.
Yeah, so Kulatha, for those who don't know, Kulatha is Horsegram and typically contraindicated for usage along with Shilajat. Can you please explain why or any scientific reasoning that you have found?
No, the reason is that Kulatha or the Horsegram is capable of breaking the stones. And Shilajatu is from the mineral pitch or something like from the Shila, and it is something like rock. And if you consume that Shilajatu for the purpose of Rasayana and all those things, it makes the body just like a rock and solid strong. And if you eat that along with the Shilajatu, if Kulatha is given, then it will spoil the Shilajatu effects, and Shilajatu will be broken down and may not be finding the results as such. So that's why it is said, while consuming Shilajatu, Kulatha should be avoided.
But can that statement be generalized to all herbs that are used for catalyst, for example, Gokshura? Can that be generalized, or it is only specific to Horsegram?
No, it is specifically Horsegram while using Shilajatu. It doesn't mean that all the lithotriptic drugs should be avoided along with that. No, it is not like that. Kulatha is also lithotriptic. It also breaks the stone. Gokshura also breaks stone. When both of them are running in the same direction, there is no problem. Then there will be a very good effect is there. But here, Shilajatu is taken for the purpose of improving the urinary tract infection and improving the urinary tract functions, and even overcome the Ashmari or something like that, or even for the Rasayana purposes. In that, the mere purpose will be hampered by using Kulatha. So that's why it should be avoided while consuming Shilajatu.
DeepMind is a Google-backed company. So they have come out with all the proteins of human body. What are the proteins are there? They have come up with the actual amino acid chains where the protein takes a turn or it gets folded. So they have mapped all the proteins in the body. So there is DNA. With the DNA message, the genetic information, the different proteins are produced in the body, and they have mapped all the proteins in the human body, and also along with that they have mapped around 10 other organisms. So genetic information gets transformed, genetic information or Shakti gets transformed into the physical body or physical compounds like proteins. So now we are in a time and age where each particular genetic information gets transformed into which protein and all. So we are in a kind of a exciting time, and I mean the implications of that, or the medical use of that, would be that we'll be able to understand the disease process better, and which proteins, most of the chemicals in the body are neurotransmitters and are all actually proteins. So in that way, we'll be able to know the actual mechanism and understand the human physiology a lot better. So thereby even the treatment choices coming up will be a lot better. So in the last class, you said a very important thing, that whatever the medicines that we may give in terms of Rasayana and people living for 100 years. So unless the diet and lifestyle and the genetics, the beta that you explained, unless all these things are in line, a person may or may not live for 100 years. And I also see that it's so very important that even with the Ayurvedic medicines also, we have to be careful not to over promise or under promise. So Ayurveda treatment works along with the diet and lifestyle components also.
Yeah, definitely. All the things it's a multiple approach. It is not simply by a drug, diet, drug, even the way we live. That is also very important. That's what in the basic classics itself said. It's a Kala, Artha, Karma. All the three in a very neat manner. If you use it, then if everything will be in line. Kalartha karmanam ihina yoga mityati matraka samyak yogascha vijnayo rogha rogyaika karanam. So that is what the whole meaning of that. How qualitatively we use Kala, Artha and Karma, accordingly our lifespan will be. So to add it to that, if you want to increase, you can add to that Swasthartha Dravyas, you can add Rasayana, you can add seasonal detoxification, you can add Achara Rasayana and everything that will definitely enhance the lifespan. That is that quality lifespan will be enhanced.
Yeah, Dr. Shilajit, he's from Kerala and he underwent 1 month of Kuti Praveshika Rasayana after Panchkarma. So 1 month he stayed there. And one of the presentations in Ayurveda Shala podium back in 2019, he explained that though he has undergone 1 month of rigorous Kuti Praveshika Rasayana, living in a hut and following all the rules and whatnot, he may put on weight if his diet is not followed properly, or whenever he changes the rules of his diet, he can put on weight and all. So the diet and lifestyle along with the therapies, they work in a combination, then they cannot be separated.
No, that's what I said. See, in a classroom, we have got 50 students, the same teacher, same subject, teaching the same thing in the same manner. But the people who absorbed it very well, they're very able to reproduce the things. But there are certain people who don't understand that and will not reproduce it. So that's entirely depend on how much the student has the capacity to absorb what the teacher is saying. Similarly, in our body, we have a typical agnis here and there. Those agnis are capable of digesting and carrying those material to the places where it is required. Then the important one is vata, whether our body has a sufficient quality of vata and whether vata is under the proper influence and whether vata is doing the proper functioning. Then only we can have proper pitta and kapha doing the things. So all these things play a role, not only simply presence of some protein there over there, it will definitely going to yield no such things, because we have a varied personalities, prakritis are different, food pattern is different, living style is different, stress factors are different. So we cannot say simply because of one drug, if it is given and the person's life will be enhanced. No, it's not like that. Taking the detoxification timely, consuming the food properly according to the Agni, maintaining the Agni, all doing Abhyangam, Nityamacharet, on these things. Every principle said in Ayurveda, if you are following, able to do it, then it is good. It can be added advantage in reaching the 100 years target.
Sir, Dr. Janardhan sir and Gururaj sir, I thank you both of you for this discussion. Sir, just it is a request from my side and hopefully it will be from all the others too. Now, recently next in the July 20th, we have a hepatitis day. So, can we have such a kind of Ayurvedic discussions regarding this hepatitis day or next World Health Day? If this kind of discussion is involved, we can truly face the other people, like how even Ayurveda also helps in hepatitis conditions. So can we have these discussions in near future? Please, it is a request from all our doctors, hopefully.
You might or might not know, you have asked for the right question to the right teacher, because of all the diseases that Dr. Gururaja teaches, liver disorders, he is expert. I'm not saying that he's not expert in other things, but the liver and skin are his dominant areas. We may not keep that on particular hepatitis day because he's busy, and also
Sure.
we'll continue it in the Sundays because we are kind of both are comfortable. We are not comfortable in Sundays, so we will continue that. And I have a long list to talk to. We'll discuss everything, and of course, this hepatitis and liver disorders in general will also be discussed with him. Rather than I asking questions, probably we'll have a class of him, he conducting the class, and we will all listen.
Thank you, sir. Hope to see this kind of discussions even in Sundays also, or whenever sir is free or something, so that even we can face the challenges more easily with Ayurveda. This hepatitis condition, it is a kind of thing where we have not touched yet. I don't know, still we have not come across these questions in our group. So I just humbly request you both to have a discussion of this kind, sir. Thank you.
So if you have kind of a case in which you want to study, come back on next Sunday same time, and or send to me by email or WhatsApp the case itself. Then I will forward it to Gururaja sir, and he may come up with a treatment plan. So that will also be fine. I understand that she wants to add liver diseases into her arena and expand her clinical practice. So we will, of course, I'm sure that Gururaja sir will cover that. So thank you very much. See you next Sunday. Namaste. Thank you very much, Gururaja sir.
Thank you.
Thank you. Thank you.